Hey,
We're back here again.
we are. I guess I'll start. We've been ordering different panels for people. And one of the questions that we get
Panels
asked,
of lab work.
panels of lab work. Yes, thank
Okay.
you. One of the questions we get asked quite frequently in the office is why we are ordering two tests that
Right.
they have never had before. One of them is lipo,
Lipoprotein little a,
okay, and the other one is ApoB.
apolipoprotein B.
Right.
Yes.
So I want to go over that with you just quickly because, again, every week it's a question.
Right. It's a good question. We do pretty extensive lab evaluations on patients. The average patient of ours, so many of our patients are older, menopausal. We're thinking of putting them on hormone replacement therapy. They're concerned about their general health. They want to lose weight. And we want to be sure that we know as much about the patient before we start any of the things so we can avoid any potential problems. If we take it's really very similar for the weight patients and hormone replacement therapy patients that we do this lab work at the first visit. Now, they may have had lab work done by their primary care physician before they come in.
Yeah, they have, but they have never had this test ordered.
Yeah,
These
I
two
know. I'm
tests.
getting to that.
I
Okay.
know, but I just was telling you.
Okay. I know that's the real question here. I'm trying to
Yeah,
give it a full answer, but
okay.
to be apolipoprotein B is another way of looking at cardiovascular risk. ApoB, as it's referred to, is involved with transport of cholesterol.
Okay.
And so it's another way of looking at the total amount of cholesterol in the body and the potential risk of cardiovascular disease because of this cholesterol. I am not a lipid expert, but I do know things that are recommended by cardiologists and internists and lipid specialists
Yeah.
that give us some degree of risk evaluation, because particularly when we're using semaglutide for weight management and weight control, or weight loss, more likely, we're making a significant change to the metabolism of the body, and we want to avoid increasing their risk. So we want to look at where they are before we start these things. So we do a complete lipid panel, and we include also ApoB. And initially, if they haven't had it before, this lipoprotein little a. And
Well, with lipoprotein little a, isn't that the hereditary
yeah,
one? Right. Because a patient recently, I think her lipids came back alarmingly high, and we were waiting on that test, which takes longer, and it was high. So you recommended a statin.
actually, I recommend that she go and see a lipid specialist
And yes, but
to get.
I think you said she needs to be on a statin. I
Yeah.
think you said that to me.
That's a genetic
Mhm.
change that causes people to have this elevated lipid, and it's associated with sudden death.
So it's a
Okay?
really important test.
It's a really important test, and I've only learned about this recently because, for the reasons that you just said, most people, when they get a full lipid panel, don't get those two tests.
Right.
We do it because I've become aware of it listening to lipid specialists and longevity specialists, that these two markers are important. You do the lipoprotein little a, you only need to do it once. You can just get an idea of the risk.
Yeah.
Okay? There's not much you can do about it except deal with the rest of the lipids as effectively as you can. Apoprotein, ApoB, is also associated with increased risk. And so we want to know where they are. Now, the chances are that if they lose weight, their cardiovascular risk is going to be less. Chances are also that if they go on hormone replacement therapy, their cardiovascular risk is going to be less. But there's certainly been a concern about lipids, cardiovascular disease, and hormone replacement therapy. And we're only getting out of the woods fairly recently in seeing and being able to show scientifically that cardiovascular health is better for women on hormone replacement therapy. Longevity is greater.
And I guess with the weight patients, what we're doing in the office is we're repeating these labs, not the lipo one, not the lipo little a, but the other one to show that their numbers are going down.
And it's remarkable that
And
almost
so-
every patient, it seems to me.
So the weight loss drugs are lowering their lipids that were
Yeah.
pretty high.
Whether they're high or not, they're going down.
Right.
Almost every case.
So we're running those labs.
We check
every 3
we check
months?
it 3 months,
Yeah.
and then 6 months later, and then yearly.
Yeah. So that's really good.
Yeah, I think so too. But it does raise questions, and it does increase the amount of work, but it absolutely significantly increases the safety.
Yeah, I think the problem has been that in the office is that there's the grouping of labs that come back the next day, and then the patient is waiting another week for
Right.
that lipo little a.
Yeah.
And I think that's what's been difficult, but it's a test worth having.
It's very much a test worth having.
Can
But
save your life.
what I am wondering about, and maybe incorporating into our practice, is the patients when they come into the office, particularly the weight management patients, the ones that want to lose some weight, they want to do it yesterday.
I know.
And so me delaying them by 2 weeks to get lab work may not be in their best interest. So if we just look at the lab work, even when it's not completely back, if we've got, it may be very reasonable to start them on the weight management and keep a close eye.
Yeah.
And just,
And then wait and get the rest that one last.
yeah, and
lab.
go, yeah, we can start without getting that, without too much danger.
Yeah.
But it's really remarkable now that we're seeing strong evidence that cardiovascular disease is diminished by semaglutide treatment and also with HRT. They really hand in hand.
Yeah. It's great. Okay. Thank you.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.